Hi, I'm Dr. Chantel Thornton. Now that you've been booked in for surgery, I'll be sending you occasional brief videos, information and tasks before and after your operation to ensure that you're well informed about the operation and to make sure you have the best outcome from surgery. So please make sure you take note of any SMSs, watch the videos and complete the tasks I send you. I will start now by going over a brief summary of the operation you've chosen to have. You are having a subcutaneous mastectomy. A subcutaneous mastectomy is performed with an immediate breast reconstruction. The entire breast will be removed and the entire skin envelope, including the nipple and areola complex, will remain intact. There are different styles of reconstructive options and the plastic surgeon will do an immediate breast reconstruction at the time of surgery. A small tissue expander, which is like a bag of fluid, or an implant will be placed under the pectoralis muscle. The plastic surgeon can also take tissue from elsewhere in the body to make you a new breast. The breast will not look the same after the operation, but you will have fullness in the bra and we'll do our very best to minimise scars and make the breast look as symmetrical as possible. The goal is obviously to keep the nipple and areola complex. However, we do take small scrapings behind the nipple at the time of surgery, which are sent off separately to the pathologist. If when the final pathology is obtained, there are cancer cells in these scrapings, the nipple will need to be removed at a later date. There is also the potential chance that the nipple may die back after the operation and therefore would need to be removed at a later date. You are also having a sentinel lymph node biopsy. This is a process whereby the first lymph node that drains from the breast to the armpit is identified. This is done by injecting some radioactive tracer material into the breast the morning of the operation. Then, when you come up to the operating theatre, you will also have some blue dye injected when you are asleep. The injection will sting a little bit like a bee sting, but the pain will go away quite quickly. You should also be aware that you'll get a blue-green coloured nipple and blue-green coloured urine afterwards. The staining of the skin can last up to 6 weeks. In theatre, I make a small incision under the armpit and use a probe to help find the very first lymph node that drains from the breast to the armpit. The technique has been proven in breast cancer to identify the sentinel lymph nodes. We know that if the sentinel lymph nodes are not involved, then we usually do not have to go back and dissect the rest of the armpit. We use this technique for early stage breast cancer. The number of lymph nodes removed varies from patient to patient. It depends on your personal situation and what the tracer and blue dye injections show us on the day of the operation. The average number of lymph nodes taken out is usually 3 to 4, though I may take out more or less depending on your case. As with any surgery, there are some risks involved. These include risks associated with the anaesthetic and risks associated with the operation itself. Anaesthetic risks include a chance of a DVT, which is a blood clot in the legs, or a pulmonary embolus, a blood clot travelling to the lungs, stroke or heart attack. These are very unlikely and we do many things to reduce the likelihood of these occurring. Your anaesthetist will discuss these risks with you further. Risks associated with the operation itself include general risks that occur any time after an incision is made on the body. These include infection, bleeding, or hematoma, which is a collection of blood, and scarring. There are also risks specific to mastectomy, such as seroma, which is a collection of fluid under the skin. This can be easily dealt with post-operatively. There is also a syndrome known as phantom breast pain, whereby there is a sensation that the breast still exists after it has been removed. This is an uncommon situation. There are also some specific risks associated with sentinel lymph node biopsy. These include a slight risk of allergy to the blue dye, and this reaction can range from mild to severe. But you will be in the operating theatre with the anaesthetist who can monitor you for this reaction. There's also a risk of damage to the nerves and lymphedema. There are small nerves which run under the armpit, and these occasionally need to be sacrificed or cut to get the lymph nodes out. This can result in the feeling of some tingling pins and needles or a numb patch in the side of the arm or the inner part of the chest wall. As always, if you have any further questions, please don't hesitate to contact me or the breast care nurse.